Before beginning the enteral feeding process, it is essential to gather all the necessary supplies. This includes the feeding pump, the appropriate feeding bag and tubing set, the prescribed formula, gloves, and any additional equipment required based on the patient's specific needs. Once you have everything you need, it is important to wash your hands thoroughly to ensure hygiene and minimize the risk of infection. Next, you will prepare the formula as per the manufacturer's instructions and the patient's dietary needs. This may involve shaking the formula well to ensure it is properly mixed or adding any necessary supplements. Check the formula's expiration date to ensure its freshness and discard any expired products. Carefully pour the prescribed amount of formula into the feeding bag, ensuring not to overfill or spill. If using a pre-filled, ready-to-hang feeding bag, check the expiration date before use and ensure the contents are properly mixed by gently agitating the bag. Once prepared, label the feeding bag with the patient's name, date, and time of preparation to ensure proper identification and prevent any mix-ups. Always follow the manufacturer's instructions for both the feeding pump and the formula, as they may vary. If you are unsure about any step of the process, it is crucial to consult with a qualified healthcare professional for guidance and support. Proper patient positioning is crucial for safe and effective enteral feeding. An incorrect posture can increase the risk of aspiration, which is when food or liquid enters the lungs, leading to serious complications such as pneumonia. To prevent this, always ensure the patient is in an upright position before starting the feeding. For patients who can sit up, elevate the head of the bed to at least 30 degrees. This helps keep the airway above the stomach, reducing the risk of aspiration. If the patient cannot sit up independently, use pillows to prop them up in a semi-Fowler's or Fowler's position, ensuring their head and shoulders are raised. If using a feeding tube that is not already in place, insert the tube according to the manufacturer's instructions and confirm its placement before administering any feed. This is typically done by a healthcare professional using methods such as measuring the pH of aspirated fluid or using X-ray confirmation. In addition to proper positioning, always check for any signs of discomfort or difficulty breathing during feeding. If you notice any of these, stop the feeding immediately and consult with a healthcare professional. Before connecting the feeding bag and initiating the feeding, it's important to prime the tubing. Priming removes air from the tubing, ensuring that the patient receives the prescribed amount of formula and preventing air from entering their digestive system, which can cause discomfort and complications. To prime the tubing, close the roller clamp on the tubing and then connect the feeding bag to the tubing set. Next, open the roller clamp and allow the formula to flow through the tubing, filling it completely and removing any air bubbles. Once the tubing is full, close the roller clamp to stop the flow. With the tubing primed, you can now connect it to the patient's feeding tube. This is done by carefully connecting the end of the feeding tube to the patient's enteral access device, ensuring a secure connection. If the patient has a gastrostomy tube or G-tube or jejunostomy tube or J-tube, this connection may involve a specific type of connector. Always double check the connection to ensure it is secure and that there are no leaks. Any leaks could lead to formula spilling and potentially causing skin irritation or infection. Once the feeding is set up, You need to monitor the patient for any adverse reactions and ensure the formula is being delivered as intended. Observe the patient for signs of discomfort, such as bloating, nausea, vomiting, diarrhea, or constipation. These can be signs of feed intolerance or other complications. Regularly check the feeding pump to ensure it is functioning correctly and delivering the formula at the prescribed rate. If you notice any alarms or error messages, consult the pump's user manual or contact a healthcare professional for assistance. Monitor the patient's fluid intake and output as well as their weight to ensure they are adequately hydrated and receiving appropriate nutrition. After the feeding is complete, it's crucial to clean up properly to maintain hygiene and prevent bacterial growth. Disconnect the feeding bag and tubing, dispose of them according to hospital protocol, and wash your hands thoroughly.